Action News is blue today. We kicked off our Code Blue campaign this morning. We're taking action against colon cancer. Colon cancer is the cancer of the large intestine, and rectal cancer is cancer of the last several inches of the colon. We want you to know this so that you can protect yourself. Now, together they're called colorectal cancers. Like a lot of cancers, lifestyle plays a big part in this disease. Your risk for colon cancer is higher if you have a poor diet and you're obese. And here's an important note. Obesity puts men more at risk for colon cancer than women. Colorectal cancer is the third most common cancer in men and women, and every year there are thousands of new cases. In fact, more than 100,000 new cases of colon cancer, and there are more than 40,000 new cases of rectal cancer every year. With me now is Dr. Jim Kimberly, gastroenterologist at the Borland-Groover Clinic. Thanks for being here.
Thanks, Tom. Good to be here.
Well, first, let's talk about who's most at risk. Basically, you need to know your family history and check your weight as well.
Right. I mean, one thing to keep in mind is everybody's at risk. Colon cancer is the second most common cancer killer in our country, about 50,000 deaths a year from colon cancer. Things that put you at increased risk for colon cancer would include advanced age. As we get older, we become at more risk. And then, like you said, family history puts you at a lot more risk for colon cancer. Certain disease states, certain types of colitis, Crohn's disease, also increase your risk for colon cancer.
So at what age do you need to go in and start getting your screenings?
Everyone by age 50 would be due for their colonoscopy. Certain groups earlier in that based on family history, and there's actually a recommendation from our professional society that African American patients have screening starting at age 45 as they're felt to present with colon cancer at an earlier age. Now,
before you get to the cancer, maybe if you go in for your screening, you can catch a polyp. What is a polyp exactly?
That's exactly right. So, you know, around a quarter of people, 25% of people have little growths in their colon that put you at risk for colon cancer. Almost all colon cancers arise from polyps, and it can take several years from a polyp to go from a polyp to a cancer. So you have a window there where if the polyp's detected and removed, you can prevent people from getting colon cancer.
So what can you do to make sure you're healthy as far as your eating goes? And well, okay, there's so many questions. First, tell me the symptoms, and then I'm going to go to the eating habits.
Right. You know, by the time people have symptoms, it's they often have very advanced disease. So it's very important for people to realize that screening isn't just for people that have symptoms. Ideally, you're going to be screened when you don't have symptoms. But anything like you know, bleeding with bowel movements, a change in bowel habits, unexplained abdominal pain, unexplained weight loss could be symptoms of colon cancer. But again, the important thing is to try to catch things in that polyp stage where they can be removed and not even get to the point where people have symptoms.
And can I eat better to help myself out?
Eating better can definitely help lower your risk for colon cancer, we believe. It's felt that people that have diets that are high in fat are at increased risk for colon cancer. People that eat a lot of red meat, we feel like are at increased risk for colon cancer. Things that may decrease your risk for colon cancer are a high fiber diet, and then also a diet that's high in fruits and vegetables, and also a diet that's high in calcium.
Okay, well, we tried to give you a lot of information. I know we packed into 2 minutes because we want you to be safe and, as we mentioned, possibly save your life. So go to our website, actionnewsjax.com, and we'll have all that information. Thanks, Doctor.
Thanks, Doctor.